And so our very first speaker that I would love to introduce is Dr. Nahla Gafer, a clinical oncologist who worked for 14 years at Khartoum Oncology Hospital with a huge interest in breast cancer. And she is the one who integrated palliative care services into Khartoum, into Sudan, but unfortunately is currently residing in Cairo because of the war. And so we are exceptionally delighted, Dr. Gafer, to have you with us. And we keep you and Sudan in our prayer and blessings. I invite you to begin.
Thank you so much, Professor Rick. I would share my slide. So I'm going to be speaking about the pain management and access to pain medications in humanitarian crisis. Thank you so much for the nice introduction. And this is the outline of my talk. I'll be speaking about what are the humanitarian crises and how wars and conflicts affect patients with chronic conditions, how it affects the way we die and how the way we grieve. I will bring in some stories, and I'll be speaking particularly about palliative care needs in humanitarian crisis, the need for palliative care, the evidence from local and international data about palliative care services, and especially about the availability of morphine, and what happens when the medicines are not there, what happens when the doctor is not there, and what is the response from the international world. So humanitarian crisis can be defined as singular event or a series of events that are detrimental in terms of health, safety, or well-being of a community or a large group of people. And then they can result in either short-term or long-term damage, and they can be natural disasters or man-made or both. And examples include conflicts, epidemics, famine, energy crisis, and if they are large enough, they can cause movements of a large number of peoples, causing a refugee crisis. And that is why it is very important for the international community to work together with the national agencies for the problems caused by these crises. These two rows, two columns, show us the most common and most catastrophic natural disasters. And I think if you just give a quick look, you will find them happening in any country you can be living in, like earthquakes, floods, tornadoes, wildfires, winter storms, volcano eruptions, heat waves, famines. All this is happening every day and all around the world. But the worst of them are wars. And this map shows us zones where there's wars, active wars and conflicts, and places of civil unrest. And the situation can turn in a day into a catastrophic. So how do these wars affect the patients with chronic conditions? I have a colleague of mine, she's a doctor, and she had to travel from Khartoum to another city just for seeking treatment for her aunt. And then they stayed there in a difficult situation. There's no electricity, no water. And then they traveled again to another city in the far north, in the end, to have her aunt die. And even now, she's very affected. So it's affecting not only the patient, it's detrimental to their health, but also the family. On the right here, this is burial of a person due to the war near to his house, burial without relatives, without our normal funerals that include hundreds of people. And maybe these people near to him are like unknown to the patient, to this deceased. And wars are really a big factor to think about when we are speaking about deaths and grieving. Another story is a lady who had to travel long periods. She has chronic arthritis, and her first trip was like 2 hours. And all the way she was thinking about getting more medication into her bag. But everywhere she goes, she finds the pharmacies are closed. And her last trip was across the border to Egypt. It was a 48 hours ride. And when she arrived, her limbs were very swollen and she had severe pain. And she found the resident personnel having like these clinics for the refugees, and they gave her diflunac retard. Unfortunately, it was not enough, but okay, it's something better than nothing. And the stories are numerous, uncountable, of people with chronic conditions or people who developed chronic conditions because of the war. And when we think about the situation of patients when they are in a humanitarian crisis, the physical problems increase. I'm speaking about insecurity. I'm not speaking about psychological. No, it's real insecurity, physical insecurity. You have to think about where to go, not to get killed. You need a place to stay. You need food. You need medications. You are facing physical injury because of the war or of the catastrophe that is happening. And also it can be a physical injury due to your reaction, like walking long distances and eating nothing. And so we end up with reduced immunity. You also might be suffering of loss of sleep due to continuous noise of the bombing. All that affects us. It will affect the people psychologically. They will be anxious about the situation. They are afraid. They feel displacement. They are worrying about their future. They have a lot of losses, loss of property, loss of lives, even catastrophic deaths. And in the spiritual part, yes, I mentioned there's displacement. They might be guilt for the decisions. Guilt, I didn't take that person with me. I didn't help the other people. I didn't stay. I didn't go. And a lot of issues around the death and the improper death rituals. And I just remembered the story of a lady. She was writing on Facebook, begging people to come to her aunt's house. She is far away. She's outside, I think, the country, but she was begging people to go to her aunt's house so that they can bury her aunt. Her aunt died 7 days. And they just they are begging people to go and bury the aunt. And about the social problems, of course, there's loss of work, loss of contacts, disruption of the communities, disruption of the society. You guys can go to an unfamiliar new society with different culture, different language. And of course, there are financial difficulties. And this is the situation of palliative care services. And a lot of the countries are in orange. And this means that palliative care services are limited provision. It means like 1 center, 2 centers in the whole country have palliative care, have proper pain medication. And this is data from Sudan. We have in a survey, we had 48% prevalence of palliative care needs in 5 general hospitals, and severe pain having an incidence of 52%. And on the right, this study is from Trinidad, where 57% of people who attended the outpatient clinics had chronic pain. So prevalence of pain is huge, it's there. The drugs are not available. And when we speak about the availability of narcotic drugs, especially morphine for severe pain, we have to think about it's not only that you need to bring the drug and put it in the pharmacy. You have to have the people trained on how to use it. If you just put the drug in the pharmacy, after a few months, the drug is not going to be prescribed, it's not going to be used, and the administration is not going to bring it anymore. So the training is very much linked with the availability of the drug and the services. And these are the principles of pain management in palliative care. We have to think about the holistic situation, about the physical, social, psychological, spiritual. We have to make a meticulous assessment. We have to score the pain. And with this meticulous assessment, we can think about what is the cause of the pain. And we try to treat the underlying cause. And according to the score, we choose which drug to start with. And we don't forget about the adjuvant treatments. And very important in low and middle income countries, patient and family education. We have to explain and to repeat again and again when to use this drug, when to increase the dose, when to stop it, the importance of the laxative. And we have to do a reassessment after 1 hour, a reassessment after 4 hours, and after a week. So what happens when the drugs are not there? Some patients try to economize. So in Khartoum, even before the war, we had a shortage of morphine, and everybody knew about it. And one of the patients had a stock, but she was afraid her stock would run out. She used to have like 4 tablets of 15 milligram morphine every 4 hours. So she started economizing. Instead of 4, she was using 3 tablets. She didn't tell us, but she came in a crisis. She came with uncontrolled pain, severe pain. She came to the clinic. And when we investigated, we discovered that she already tailored down her medication so that it will last her more. That is not a solution. It's okay to reduce the amount, but let's add something more. We can make use of other medications like diflunac potassium. We add paracetamol in full dose and in the regular and the proper timing. Also, we should not forget about other treatments, herbal treatments. Cloves is wonderful for toothache. And on the right, this is called devil's claw. It's present, it's available, it's present in large parts of Africa, and it's very good for chronic arthritis. Non-pharmacological interventions are very important. Meditation, citation of the holy verses. In Islam, we have ruqya and acupuncture, yoga, listening to music, singing, also interactions, social interactions, getting involved with people, helping other people, the use of heat, cold applications, and massage. All this help. When the doctor is not there or when the hospital is not there. So this is a makeshift clinic. This doctor is in Omdurman. He found himself in a situation where, like, we have 26 hospitals bombarded in the first 2 weeks of the war. So he went to a classroom and he trained some volunteers. So these 2 volunteers are trained to be nurses, and they were treating the patients that are affected, especially with injuries due to the war. And so we make use of everybody. Pharmacists are a good source of information, clinical officers, nurses, midwives, medical students, volunteers, your grandmother, and online consultations are good, but it depends on the internet. And we used to have direct contact with our patients, and we know the problem of the internet. So whenever a patient asks one question, we have to give complete answer, because we don't know when this patient is coming back again, or when is he able to put another question. So just to be in the safe side, we give a complete, elaborate answer with tackling all the parts. And of course, when we have unmanaged pain, we have increased litigations, fighting, family conflicts. We have deterioration of health, depression, even leading to suicide. We have loss of faith in humanity, loss of faith in oneself, loss of faith in God, we have a lot of suffering for the patient and for the family. And there is response, there's an international response. The EU humanitarian aid and emergency response, there's the WHO humanitarian response plans, the Red Crescent, the UNHCR. But the question, is it enough? Is it timely? And does it reach to those it is intended to reach? 2 examples. I went to the UNHCR. I stayed for 6 hours under the sun to receive 400 Egyptian pounds. It's something like 10 British pounds. So I was staying there for 6 hours under the sun, and still I couldn't get it. I went home and I was sick for 2 days. The other example is of people who reached Egypt. A lot of people traveled from Khartoum and went to the border in the north. But those who were successful in getting access to Egypt were the resident people in Halfa, who were actually not affected so much by the war, but it was easier for them to get the visas to go to Egypt. So we need international action, but this international action has to be linked with the people under the ground and has to think about the people, who are the people affected and how to help them exactly. I will finish my talk with some recommendations from the value of alleviating suffering and dignifying death, this paper, which came last year. And it emphasizes the leverage of multidisciplinary academic, clinical, and policy stakeholders, and advertising also for telehealth support and creating pathways for controlled and essential medicines to manage pain and other distressing symptoms. And it's also advocating for integrated palliative care in times of peace and in times of war. Thank you.